Hi, everybody. I too am really excited about the speakers we get to hear from tonight. And I have the pleasure of first welcoming two of them. Alejandra Lopez and Tasha Nijjar are here from Sanctuary Health. Sanctuary Health is a grassroots community group who are working with immigrant and refugee communities. And they believe that all migrants should have access to health care. And they're going to talk with us a little bit more about that tonight. Thanks, you two.
No pressure. Yeah. Thank you for the really, really nice introductions. My name is Alejandra Lopez, and I'm also a visitor in this land. So I reflect or try to reflect every day on how can I work in solidarity with the indigenous people of this land. There's one thing that I want to say too is that there's very many journeys of migration, and I feel that being here is a privilege, that not very many other immigrants can speak out because they fear for their lives or they fear for being deported.
My name is Tasha, and I also would like to identify myself as a settler on this territory. And when we're thinking about the work that I get to do as part of Sanctuary Health, and also in my life thinking about this land and what it means to be here, also many of the struggles that refugee and migrant communities are facing is a result of the same stories of colonization. So whether that's because there are Canadian mining companies appropriating indigenous land and people are being forced to move here, that those struggles are connected. And so it's important to recognize the histories that are here and how that's connected to struggles that our people are facing elsewhere.
Sure.
Also, who's going to tell us when our time is done? Because time is also a colonial construct, and we're not good at that.
Yeah, so if someone check the time, you are. Okay, good.
All right, thanks.
We're just going to tell a bunch of
We're just going to talk until you tell us to stop. That's what's going to happen. Yeah.
We were invited to talk about the challenges of that immigrant and refugee communities face accessing health. That's a very big topic. But we want to start just sharing a little bit about how we got together as group Sanctuary Health, trying to advocate for health for all, regardless of your immigration status. We got together in 2012 when the federal government decided to cut the interim federal health program for refugees, which wasn't comprehensive, but it was some basic healthcare for refugee claimants and government-sponsored refugees.
Yeah, and so just to give a little bit of context, or I might be saying things that people know, or I might be saying new stuff. It's kind of funny because I think you're in the mic and I'm not, and I don't know how that, it sounds weird.
We're both in the mic.
Okay, good.
No, you just need to be like really facing it when you're talking.
Okay, so like this works,
Yes.
but this doesn't work. Okay, yeah, all
Okay.
right. So when we're thinking about healthcare, I think lots of people in this room are passionate about healthcare, have some understanding about the different needs that people have around health, and could imagine that someone coming as a refugee or a migrant, and our TV screens currently are occupied with images of people making those crossings, and you can imagine that there's a real and urgent need for lots of type of support that's quite holistic and thinking about all the different determinants of health, so housing, and then also support with basic needs. And that was the purpose of the interim federal health program, was that when people arrived, there's a period between when you arrive to when you're going to get any type of status, and that could be short. It could be a couple of days, or it could be a couple of months, or it could be a couple of years. But the idea behind the interim federal health program was it was meant to be you arrive and then you would get access to the services that you need until some other MSP or other services kicked in. So that was the idea behind this program, and it was recognizing that people are going to come here and they're going to need services right away, and that providing that support is an essential responsibility when we're thinking about our role in being connected in solidarity with global struggles and being supportive of migrants and refugees. So that was the initial idea behind the Interim Federal Health Program. And then those cuts came in June 2012, and there was a meeting held here in Vancouver with healthcare providers and concerned people, migrants and refugees from the community, talking about what they could do about this. And then a group of people decided, well, this is an issue we really want to take on, and that's kind of how Sanctuary Health got formed. To tell you a little bit about Sanctuary Health, we're grassroots collective of people, healthcare workers, migrants and refugees, concerned community members. We're totally volunteer. We're also nonpartisan, so we'll talk about the different policies. A lot of the policies, these negative policies started with the federal Harper conservative government, but that's not the only place that they've come from. So that's a little bit about us.
Yeah, and some of the, one of the first things, we were never intended to be service providers, but when we started advocating for the provincial government to step up to the plate and provide these services, which happened in other provinces, we haven't been successful with this provincial government, but we realized that it was not only refugees that were facing these challenges, but a lot of people that, as a consequence of the different changes on immigration laws, were pushed to stay in Canada with precarious and temporary status, and they were also facing challenges accessing health, whether they were temporary agricultural workers or living caregivers or refugee claimants, which are now not served by the settlement organizations. And so there's a big spectrum of people, as I said at the beginning, of how they come here, the reasons of why they come here, and how they end, in a situation where they have access to no basic services. And so we started organizing some clinics, and we were faced with like a lot of realizing that there was like a big community out there, pregnant women that weren't able to access prenatal health care, that they couldn't afford to pay the like incredibly ridiculous rates that they were getting charged for having their babies or accessing basic health care in hospitals. Also, a lot of workers that are working with precarious status, when they had accidents in their workplace, they had absolutely no coverage. And a lot of families with children that they had nowhere to go to access health.
To share one story or an example of the way that this has played out and how detrimental it can be for people's health, there was a gentleman who we got contacted from. He was here working in construction, had been living in Canada for many years, had a history of diabetes in his family, but didn't access any preventative care because he couldn't afford it, and it would have there would have been a risk in going to see a healthcare provider that maybe someone would find out about his status and report him to CBSA, or and that he might be deported. So he didn't access any health care, and he wound up actually had a history of diabetes in his family that he knew about, and found himself in a diabetic coma and was in the ICU at the hospital. And while he was in ICU, he was, as he woke up, was visited by CBSA, and luckily someone got in touch with one of our other people who's part of Sanctuary Health, and we were able to go to the hospital and do some advocacy, but really essentially had to rescue him and get him out of the hospital before he was deported by CBSA. So if you can imagine waking up from a coma, you are in ICU, you almost lost your life, and the first thing you're dealing with is having to worry about not getting deported, and you're still not dealing with the fact that you now have pretty severe diabetes that you need to deal with, and you need to get medication for that, and all the different costs that come around through something like that. And you can imagine the huge costs. And I think, again, this is a room of people who care about healthcare. We all know that preventative healthcare is almost not only better for people, but it's more cost effective for a system. So we're really pushing people into these places where they're in really urgent situations and having to make decisions. You know, we've had pregnant women who are deciding, like, am I going to have my birth quietly in my house and hope that my neighbors or my landlord don't hear anything so they don't call the police on me, because I don't know if that's a system that's going to be safe. And so that's kind of led us to some of our principles about access without fear.
Mm-hmm. And one of the things that I wanted to highlight is that doing this work for us, like Tasha talked about the social determinants of health, we definitely advocate for adding immigration status as a social determinant of health, because it definitely affects not only in terms of very basic access to health, but the amount of stress that people go through when they are in this situation, that they are going to get separated from their families. It's not only the physical health, it's the emotional and mental health that they are dealing with for years. For years. How many times we heard, I want my life back. Mm-hmm. I can't plan ahead. I don't know if tomorrow this is going to be my home or where my home is going to be. And this is the realities of a lot of people in Vancouver and in Canada. Mm-hmm.
Do you want to talk a bit about
Sure. Through doing advocacy with different service providers in the health sector, we've been very fortunate to build relationships with people that have been very responsive. It hasn't been province-wide, but it has been building relationships with nurses that care, midwives that care, physicians that care, that have been willing to either volunteer. We built a network of healthcare professionals that were willing to volunteer their time. The first thing we asked them is what we want is for you to open the front doors for people that are uninsured, potentially in your workplace. But if that's not possible, that you're willing to volunteer in emergencies, because the other thing that we want to emphasize is the fear that people face, that even if they might be eligible, depending on where they are in their status process, their immigration process, they just fear. There's a lot of confusion among service providers about who's eligible for what, and it puts healthcare workers in the position of deciding who's deserving and who's not deserving. And we don't want service providers to become immigration border offices, because that's not what they signed up for. And we ask these people, okay, if people are really scared of going to a clinic because they fear that the border service agents are going to be there, would you volunteer to go meet them at a coffee shop, in their house, in the corner of a street? And this is how sometimes they have to provide health care. Okay, thank you. So we built some relationships, and we've advocated for people and service providers to create spaces of access without fear, which is the main principle of the sanctuary city policy that we're advocating for. It's a municipal policy, but it's also a movement where we are asking community organizations and people working in the social services to create spaces where they don't share the information of the people that are serving, where they don't ask for immigration status, and where they are champions of the idea that services should be based on need and not on immigration status.
Mm-hmm. Mm-hmm. Yeah, so that's one of the things that we've been advocating for. There's information here that Alejandra has.
Just cut.
Yeah, just freshly.
I'm going to pass it around. They are our principals.
Yeah. They're the principles. They are something that either as individuals or if any of you are part of organizations, you can sign on and endorse. And it's really just saying pretty simple things, that you are going to provide services based on need rather than migration status, and really essentially that you're not going to call CBSA. It's just letting people know that that's not a thing that's going to happen. I guess one quick thing too is the increase in concern about CBSA and border security definitely existed before the cuts to IFHP, but in the last few years under this federal government, there have been agreements that have been signed, and that has really, we've seen a big increase in that. So that's also something to just, another way that our health is affected. And I think a lot of the rhetoric that we hear is about it being this huge cost saving, that now they've cut all this stuff for refugees and for what are sometimes called bogus refugees. That's not a thing that exists at all, but that's the term that sometimes this government chooses to use, and talks a lot about the cost savings. I think the cost saving from cutting the interim federal health program has been around 53 million, and at the same time the government has spent over 1.8 billion in building new detention centers for migrants. So the idea that this is about cost saving, I mean, you all know that is untrue, but there's really clear evidence that they're spending more money on detaining people and doing deportations than they are on preventative things like helping pregnant women get access to ultrasounds during their pregnancy, things that would be really helpful and important. So the principles are really great. If you're interested in talking more about that, you can talk to either Alejandra or I. We would really love to see the interim federal health program reinstated, either by the federal government. Also, the provincial government has the ability to step up. It's something that we had a petition and did ask this government about. It didn't happen, but it could still happen. It's happened in other provinces that they've stepped in to fill that gap. Anything else?
No. Do you have any questions?
If there are people here who belong to organizations that aren't necessarily providing services, would you want those kinds of organizations to also
Yes.
and support?
Yes, we're looking for people and organizations that endorse the principles, because we're not only doing the community piece of building and creating access without fear, but we want the city of Vancouver to pass a sanctuary city policy. So it would be great if you're interested in sending council a letter endorsing our principles. Anything you can do, let us know. Yeah, thank you.
Thank you.